Rheumatoid arthritis can make every joint ache worse in the winter. But what if it isn't just the cold? For many people with rheumatoid arthritis, vitamin D could be quietly adding to the inflammation. It's one of the most common deficiencies that we find. And while adding vitamin D isn't a cure, it's not a medication that will treat your rheumatoid arthritis directly, keeping it at a healthy range could make a difference for your bones and possibly your flares too. Let's look at what the research actually says in 2025. I'm Dr. Neha, a rheumatologist and lifestyle medicine specialist, and today we're unpacking the real relationship between vitamin D and rheumatoid arthritis. Let's dive in. Research consistently finds that people with rheumatoid arthritis tend to have lower blood levels of vitamin D, somewhere around the range of 20 nanograms per milliliter as opposed to 30 or 40. And lower levels often go hand in hand with higher disease activity scores, like something we refer to as the DAS28 score. And for you, it might be more joint pain and fatigue. But correlation does not mean causation. So it doesn't mean that having a low vitamin D caused your rheumatoid arthritis or is definitely making your RA worse. Because it could be something like people with rheumatoid arthritis may spend less time in the sunlight, maybe they don't want to go outside the house, or you could be taking medications that interfere with vitamin D itself. This sounds simple, right? If you're not getting enough vitamin D, just pop a pill and you should feel better if the studies are showing that it helps with rheumatoid arthritis. Unfortunately, it's not that simple. When researchers tried to do this, give these supplements to people, the results were kind of mixed. A few of the small studies did show improvement, slight improvement in markers of disease activity, but others didn't show any difference or they were similar to placebo. So what's the takeaway here? Vitamin D may help you if you're truly deficient in it, but it doesn't replace your medications or stop the disease on its own. Still, maintaining healthy levels is important for your bones, especially if you take steroids, because we do know that it contributes towards osteoporosis, so having thinner bones, thinner bone density, and so we know that having vitamin D as a building block is essential. But it also might have some mild immune supporting benefits as well. Think of vitamin D as a quiet moderator in your immune system. When it's at the right level, it helps your immune cells know when to calm down after they're fighting infections. When it's too low, that stop signal doesn't come through as clearly, which can let inflammation linger, and you don't want that. Scientists can see these effects in lab studies, but in real human beings, the results can be very varied. More importantly, why are people running so low on vitamin D? It's not just rheumatoid arthritis patients, it's really a lot of people in the general population. Even for healthy adults without RA, it's really tough to get it from food. And people with rheumatoid arthritis, they face extra challenges. There could be less sunlight exposure because you're in pain all the time and you don't want to go outside, or you're fatigued and don't feel like moving. You could have altered vitamin D metabolism because of some of the other medications you're taking. Or maybe you're on a restrictive diet. Somebody told you to try this new diet, so you're not eating certain foods which could be high in vitamin D. So deficiency is common, especially in the winter months. Let's talk about practical ways that you could improve your levels. So if you're looking at food, fatty fish like salmon, mackerel, sardines, they can be helpful, as well as egg yolks. Right? We tell everybody stop eating the yolks from the eggs, that could be harming you, but actually that's where the vitamin D is. If you prefer vegan milks, you could do fortified plant milk, or you could get it in your cereal or even in your orange juice. And my favorite option, which is a plant-based option, is actually mushrooms. Specifically though, UV exposed mushrooms. It's not all of them. Mushrooms make vitamin D when they're exposed to sunlight or UV light. You can even put them gill side up in the sunlight for 15 minutes to kind of boost that content. What about supplements? Well, most rheumatoid arthritis patients still do need those. You can take vitamin D3, which is cholecalciferol. It's probably a little bit more potent with absorption, but if you can't find that, ergocalciferol also can be very helpful. Remember though to take it with your largest meal, and a healthy fat is of course the best, but a heavy meal, not when you haven't eaten in several hours. And when I say healthy fat, I mean olive oil, avocados, or a nut butter, and that can help with absorption. The morning versus the evening doesn't really make much of a difference here. It's really the consistency. Okay, so what's our final take on the evidence? We know that low vitamin D levels are common in rheumatoid arthritis, and it could be linked to worse inflammation. But supplement trials haven't shown that it dramatically changes outcomes. Still, we know that vitamin D does support bones, muscles, and immune balance. And deficiency is actually pretty easy to fix. So certainly it could be part of your overall RA care plan. If you haven't checked your vitamin D recently, then ask your rheumatologist or your primary doctor. It's just a simple blood test, and if it's really low, it could be impacting you. Take care of your joints. Don't forget your sunshine vitamin, and I'll see you in the next video.